Let's move on to the last table. The questions have disappeared, but I know it was about involving the patients and the public in commissioning. So tell us what you got to, Natasha.
Okay. So our discussion sort of started with the question around, will CCGs be motivated to engage patients, and will they actually engage with this agenda? And the feeling around the table from GP colleagues specifically was that it has to be done. It's part of the authorisation process, so we may as well do it well. And the fact that it is part of the authorisation process was seen as an important signal from the centre that it is a priority. But CCGs will have to identify and get to grips with how to do it so that it adds value, and part of that will be about understanding the population and working with population and local authorities in understanding needs. There's no consensus about how to do it, and it's not something that's been done particularly well before. So CCGs are going to need support and resource in order to do it well. And there's also going to be a need to share what works well. And if we can show that it can work and can add value, then it will engage more GPs to do it well. A lot of our discussion was around the fact that it's not a single thing and it can't be done through a single patient forum. And there's a risk that if it is seen as a single thing, then it becomes quite tokenistic. So it's important to see it as a series of different processes, and the fact that you might need different approaches. And it'll be important to segment both the population and the processes of commissioning in order to understand how to engage patients at different scales and at different stages. So the challenge for CCGs will be doing it well, ensuring it's not tokenistic, but also knowing when they're doing it well and having some sense of or measure of how well they're doing with it, and that'll be a real challenge. We think that there are good examples of patient engagement that have gone before, and it'll be important to build on the good, not change what is working, but change what is bad. And part of our question was, will it be different to what PCTs did? And we think that CCGs do have an advantage there in that they are engaging with patients day in, day out. They know the populations better. They're not a faceless organisation. Patients will know the GP practice. So they have an advantage in that sense, but the challenge will be actually translating that feedback that they're getting on a daily basis into real change. And just finally, obviously the implementation, the success of it will depend largely on culture and leadership. But there was a positive sense on the table that because CCGs will be self-selected, that maybe there'll be a group that will be more inclined to engage with patients.
Do you think it will be easier? It sounds from what you're saying, it'll be easier for them to capture patient experience, and it may not just be through the interactions between the doctor and his or her patient. But that'll be easier for them than engaging the wider population in complex decisions about should we buy this or something else, and how much. Is that public engagement around the difficult decisions of priorities going to be more of a challenge?
Not necessarily more of a challenge than it was for PCTs, but I think we recognise that that's something that no one's ever really done very well, and so the challenge is in making sure we do it properly, and that public and patients are involved in the commissioning decisions rather than just asked about something when we've decided it.
Yes. Do you sign up to this? Exactly.
Yeah. Methodologies out there. I remember when we did the Darcy Community Care Strategy, we were quite keen, as Patricia Hewitt was, on deliberative process, rather than the Blue Peter, I'm going to consult you now. It's a continuing relationship we need, and different ways of approaching. Otherwise, it becomes nonsense.
And I think in those deliberative processes where the public are brought into the tent to understand some of the problems and trade-offs that commissioners have, they can be quite receptive. But you need to build that knowledge and honesty into it. Any other comments on public relations?
Also commenting that, you know, it's not an easy job. It's not a matter of pulling someone in off the street and saying, sit there and tell us what you think. There's going to be a lot of upskilling needed for public and patient who are involved in commissioning decisions, and that requires resource and time to get that working.
Definitely. Steve, you want to come in there?
Yeah, I mean, part of our sort of listening work has been engaging hundreds, thousands of the public in different groups. And there are different methodologies, but the hard-to-reach groups are the ones that always get forgotten, and they're the ones with the most complex needs. And some of our best meetings have been with homeless people, with the third sector involvement, housing, and local government. And I think one of the issues here is to not forget, as we won't, that CCGs aren't just about healthcare. It's about health and social care, education, housing, economy. And we've really got to make more of an effort to get out, because the services I've seen for the homeless are best designed by the homeless with the third sector engagement, and are worst designed by clinicians who don't have that day-to-day action and activity.
I think we heard the point this morning that where we can build those links with the local authorities that have a better track record sometimes than the health sector has in citizen engagement, particularly around scrutiny. I'm not sure about engaging the public around service change and that side of things. That might be still a bit of a challenge for them too.
It depends what you mean by service change.
Okay.
If you've got an area where homeless people, for example, haven't got access to primary care, and you involve them in designing the care, you get a better service.
Well, you've got no service at all to start with, probably sometimes.
Well, that's right. Oh, and they work best when you get the feedback. But if you don't, we're going to have some very difficult decisions about hospitals and services in hospitals. And if you don't engage the public now, we're not going to be able to make those decisions. So we shouldn't shirk and hide away from that. They've got to be involved straight away.